Hello, listeners, and welcome to the third episode of Compliance Deconstructed. I'm Lorie Davis. I'm here with Elvan Baker and Jessica Zeff, and today we're going to tackle the all-encompassing Medicare final rule. For those of you who aren't aware, on an annual basis, Medicare via CMS, the Centers for Medicare and Medicaid Services, puts out their annual set of updates to the guidance. Now, the important thing to note with final rules is they put it out into something called the Federal Register first as a proposed final rule. And so they make a lot of changes and they look for your feedback. Once they get all that feedback, they look at it and then they finalize the rule. The rule we're going to talk about today is effective January 1st, 2026, and it was finalized on November 2024. It's important to note that because we are under a new administration, so when it was finalized, there was a set of folks in office and in the CMS positions that are no longer there. So what we are talking about today could potentially get rolled back, could get changed in subsequent years, but this is where we are today. The reason I kind of lead into all of that is one of the big takeaways in summarizing the final rule for this year is not uncharacteristic of an admin change year. So it's not so much what is in the final rule as what didn't make it in. So three big things that did not make it in. First is guidelines on AI usage. So we had in a prior episode talked about AI and usage and guidelines. They're still working on it at the CMS level. So it hasn't made its way into Medicare Advantage, Medicare, and Medicare Cost Plan Program, as well as the elderly CMS program. So just keep that in mind. Another thing that didn't make it in is weight loss drugs, or what we call anti-obesity medication, AOMs. Those still aren't in Part D, which I know for a lot of folks is causing some heartburn. So something to think about. And the final big thing that did not make it in that they're still working through is prior authorization requirements around health equity by item and service rather than in aggregate. They want that data. They want you to report the data because they want to be able to report out. They want that transparency in prior authorizations. You know, I know we're planning a whole episode around prior authorizations, but that's something that still hasn't made it in. So those are my key takeaways in terms of what didn't make it in that I know people were clamoring for. Jess, Elvan, thoughts on those?
I mean, I'm a little bit worried given the state of affairs, the things that we're hearing about and the government cuts. And also I've just come back from the Healthcare Compliance Institute, and really the government's priorities are shifting. They're in flux. So something for organizations to be aware of and for compliance professionals to be aware of is that some of these priorities really may change over time. So, AI guidelines, we understand the administration is more reluctant to put in place for guidelines and guardrails around AI, or they just see that, they believe that AI could be best used to the best advantage without, current intervention. They're not ready yet to put those guidelines in place. And certainly there is a conversation around equity and how that plays out. And we still, all of us, need to figure out how that conversation really fits in. We know there are issues around prior authorizations, but with the government's kind of backing off of this idea of equity, we need to figure out what that means for us and how that really plays out and how that applies for our patient populations or our member populations. And I'd say certainly the anti-obesity medication, that too is a bit of a puzzle. If you've been listening to the news or to what's being said, there's really some backing off around that medication. A, because it's expensive, but also it's seen as not a necessity at this time. But really, that gets complicated, right? Because it's not just about obesity; it's about blood pressure, and it's about heart disease, and it's about blood sugar, right, and diabetes. So there's still a lot of conversation that needs to be played out. So
Yeah.
the best I can say from my perspective is that there are some, much bigger conversations that have to be had, both in terms of the risks and benefits of not addressing these, but also there's going to be some discomfort for all of us as we wait this out to see, what the results are going to be.
Yeah.
How about
Absolutely.
you, Elvan?
Absolutely. I think the lack of AI decision, it's mind-boggling because the train has left the station. We had this conversation on our previous episode. The train is gone. So now CMS is going to have a decision, and by that time, the original problem has propagated into so many different branches that I'm afraid the decision by that time is not going to address everything that it has affected in our lives.
I don't know, but
Then,
I don't think I don't honestly, and I'm not intending for this to be political. It's not a political discussion. It really is to kind of predict the future in uncertain circumstances, right? And you get that with any new administration. But I don't know that CMS or the federal government is going to get to the AI guidelines. I really don't.
you don't.
I don't see that as a priority for them. And we have an administration that's like very regulation averse. So I don't know that they're going to get to it. I really
Yeah.
don't.
Sure,
Yeah.
rules don't apply. Also not meant to be a political comment.
That is the challenge at any level, whether it's state level or federal. Whenever an administration changes, suddenly things that were top priorities become backseat agenda items or completely get lost. So I don't think that this is necessarily a surprise or a shock, Jess, to
No,
your. And again, not intending this to be political, but unfortunately, it is political
it is.
because the administration changed as a result of an election. So, moving on, other things in terms of positive things that did get added, I think something that I was relieved to see is that as part of the Inflation Reduction Act that was passed by Congress, they are eliminating cost sharing for adult vaccines, which is great news, as well as restricting that cost sharing for the 1 month supply of insulin. So those are two huge wins that, again,
Absolutely.
I hate to say it, but it could change. It could get pulled back. But for right now, effective 1/1/2026, those are two positive things that will be codified. So that's great.
Yes.
They also are adding changes to make sure that they're going to implement that Medicare prescription payment plan with modifications. So I think that's good news as well, to make it a little more standard, to give some guide rails, if you will, to folks. They're going to shorten the prescription drug event submission timeline for drugs that are under negotiation. So that $35 program. So again, I think that's some good news. And they're trying to clarify Medicare Advantage organizational determinations for inpatient setting. And I think that is important to think about from a perspective, that they don't want that part holding anything back. And they also have implemented new policies to integrate care for our dual eligible folks. So for those of you who aren't aware, when a member is considered dual eligible, they are on both Medicare, whether that's Medicare Advantage or traditional Medicare, and Medicaid. So they're on two programs. So it's important that they get the same care. They can be seen at the same level. Everything's the same. So I think that is really good news. I don't know if you two agree. You might disagree, but I think that's all good news.
I
And
think
also
it's
something.
brilliant. And Elvan, oops, I'm sorry. Elvan also raised a great point. about behavioral health. Do you want to talk about that for our
Yes,
listeners?
I think something that excites me, being in the digital health space that I'm in, that is meant to provide a non-pharmacological solution under some of the mental health guidelines that we have, is that this, with the new rule, CMS now requires Medicare Advantage plans to include a broader, it was there, but a broader array of behavioral health providers, like marriage and family therapists, mental health counselors. So this expansion creates then, now, of course, it's meant to create more opportunities and more access to the beneficiaries, obviously. But, you know, for me, I'm excited about this because obviously we are on a good roadmap to become more inclusive, to see mental health as a part of our health, rather
Yes.
than that's something that happens to someone that I kind of know out there. That
Such a
this
big
is
change.
it is such a big change, and I really am happy to see that. I definitely do personally come from a family that values mental health as much as your physical health. So this is a shift that I'm really happy to see, and I know that this expansion will create increased demand for behavioral health solutions that will make it more accessible for the beneficiaries. I really am excited about that. People will be able to, because now different and more providers are included in this, it will make it more accessible. And when things are more accessible, it's more accepted. When things are more accepted, the solutions are reachable. When we reach for the solutions, we don't get these snowball effects in people's lives. So to me, that's even a cost saving benefit, for the beneficiaries, and for overall, for all of us, because I feel like we all need help on the mental health space. So
Yeah.
These are seismic changes, really,
mhm,
in the healthcare industry. And I mean, as compliance officers, that's kind of what we deal with. It's constant change, right?
mhm,
And managing some of these. And
mhm,
and there's some, there are some gray areas here, some kind of gaps
mhm,
in what to do next. There's some uncertainty, and we work in that field as well. But managing all of this change, so it's great to read about it, but as compliance officers, I'm wondering, how do we manage all of this? Like, how do we get these messages out there? Because we tend to be the ones responsible for analyzing these rules,
mhm,
right? Getting
mhm,
the summary out there, helping our organizations
Yeah.
implement these changes. And they're huge. They're
Yeah.
really big, and it's kind of constant. It's not just, oh, you need to
mhm,
update some CPT codes or something in the
mhm.
EHR. This is like really big system wide change. But how, as compliance professionals, can we help our organizations and our people navigate some of this stuff? I guess it starts with education, right?
Yeah. Yeah. So I don't know how your organizations do it or how you've seen it done, but one of the big things we do is we call a town hall. We call in the forces. We say, hey, everybody, these are coming. It's May now. This dropped in April. So, given the size of a final rule, you need those 4 weeks to kind of get your breath
Mhm,
and figure out what's going on.
mhm,
But then you call in the troops and say, hey, gang, you have from now until the 1st of January to get all of this done. And you walk them through it. And maybe you need to do it in smaller chunks. Like today, we're going to talk about vaccines. And today, we're going to talk about, the forward looking things that they've addressed in the final rule that were in the Federal
mhm,
Register that
mhm,
didn't, that weren't formally part of the final rule, and what's changed, and talk through. And maybe you need to go to department meetings and say, hey, pharmacy, want to talk to you about all these changes in vaccines. Hey, coding friends, configuration friends, need you to do this. Hey, claims people. Hey, service center. Hey, appeals and grievances. Hey, IT. Whoever you need to do.
Yeah.
That's how we do it. I don't know how your teams do it.
No, I mean, I follow a similar process. You start with the proposed rule to kind of get certainly leadership, right? thinking about what could happen and start to plan out a little bit. Who are going to be the stakeholders? What kind of resources might you need? And then you start bringing people together, even either in a big session or group by group, and start educating. There's that communication role of the job and that education bit, and also I'd say project management bit. These are huge, and you can't do them by yourself. Whether you're a one-person compliance professional for your organization or you've got a team, there's got to be a strategy. And the strategy might not be implemented in one day. But I'd also say that when I've done this, not only have I brought people together once, I brought them together repeatedly, whether that's on a weekly basis or a bi-weekly or once a month. But to say, actually, how are things going? How's implementation? Where are you stuck? And to allow the group actually to support one another as well. So it's not all coming from me, because what do I know about the minutiae? I probably don't. But folks can share their experiences and help each other problem solve. And then there are some metrics, like how do we know? How do we report that up to senior leadership and the board? Like, how do we know we're doing this? What compliance processes have we been able to set up? So there's a huge project management aspect of rolling out these initiatives. It is not easy.
Yeah. And you also want to give folks as much time as possible, because they're going to have to write policies, revise policies. They're going to have to update technology. They're going to have to train folks. So you really want to start, giving them that January 1st deadline so that they can work backwards like you do in a good project management scenario, and do those check-ins so that folks know, okay, I'm on track for this. And so you have some grace. That the auditor may not come knocking January 2nd, but you want to be ready and not give yourself too much, leeway to be after that January date. So that's why you start as early as possible, so folks have that time to plan effectively.
Or you might need to understand where you've got risks of not making the deadline and deal with it. And Elvan, I'm going to seal my big mouth.
No, I think this is a good time to say, raise your hand and say, we think we understand it. How about you folks? To reach out to your colleagues in the compliance world and say, this is how we are interpreting, how we think we can roll it out. Can you be my sounding board? I think that is very important, because whenever we get something novel in our hands, we strive to interpret it as perfectly as possible, because natural tendency is to worry about the consequences of not interpreting correctly and not implementing it correctly. So this is a time for the compliance professional to raise their hands and say, this is what I think I'm understanding. Are you with me on this one, or am I just off base? Or to be able to say, let's have a round table on this one. And guys, this is the only topic I'm asking. I need help. Please join me on this date, sending a Google Meet, Zoom meeting, whatever out. I need sounding board. And it's okay to say that. And I think, new rules is a good time to do that networking, and actually to reap the benefits of your networking, to be able to say, I have a question. A while back, I needed an interpretation on a CPT code. I read and I asked one person, and she seemed to completely agree with me. And I'm like, completely agreeing with me is probably not a good thing for me to take a validation. So then I went into one of my contacts on LinkedIn and I said, I know we haven't connected for a long time, but this is the situation and this is what I think. What do you think? And lo and behold, within 2 days, they gave me an answer, and they poked some holes in my thinking that made me think and look enough to get to the right decision. So then I was able to go back to my company and say, this is how I interpreted it. This is how the secondary person interpreted it. This is how the third person interpreted it. But hey, don't think majority wins, because the holes that this person poked in my thought process leads me to this decision. What do you guys think? So reach out,
Yeah, but it's an amazing point that you've made. I really love it because as compliance professionals, we're expected to know an awful lot, is the truth. But the reality of it is we're not the experts. We don't know the minutiae. And actually, I am very comfortable at this point in my career leaning on my colleagues and saying, okay, well, here's what the rules say. I have an idea. And to me, it sounds so easy, but I already know it is not easy. So tell me what I don't understand. Like, here's what the rules say. What are your challenges? Does this rule even make sense? You know, you've been there. There are times when your colleagues are like, who wrote this? Because in reality, it does not work. Here are the issues, and they're really hard to get around. We've got conflicting messages, or it's technically not feasible yet. You know, all the different reasons that are very real. They're not just complaints. They're not people trying to get out of doing what they need to be doing. They're very real issues. And actually, I can say hand on heart, because I don't live claims. I don't live member services. Like, I don't live appeals. Do I know enough to have a conversation and work with people? Yes. But I rely on those folks who live and breathe those areas to be like, hey, Jess, but here are some of the challenges we're going to face. We need to plan for this. Or if there's something the technology, for example, isn't there yet. Well, how are we going to do this?
Yeah.
And I think one of the biggest things we need to take from this conversation is an acceptance. The rules do change. They are politically influenced. Priorities change. And it's okay to have those conversations with people as part of your education. Well, here's what's still being worked on. We need to keep an eye on it. Here are the things we need to do. And it involves all of us. And it's okay. We rely on each other for expertise.
Yeah.
And that's, you know, where I get to. It's a big ask. Certainly this year's rule, including the uncertainty. I'm waiting for the next Medicare final rule to drop. Or I don't know. Have you? Doesn't matter. Waiting for the next one. There are so many that keep dropping. Well, this isn't the only one, right? You get the Medicare physician fee schedule. You get the home health. You get hospice. And you're like, oh my goodness, what's going on? You get skilled nursing. And they're all facing these same kind of, some areas are in limbo. Some are seismic changes, right?
Yeah.
And so all of us are trying to figure out how we respond and how we handle.
Yeah. So some other things that are future coming is that behavioral health benefits, that's all around, you know, all extensions of that mental health Equity and Addiction Act, or MAPIA. So they're looking to make sure that behavioral health gets that equal love that we talked about earlier. Another thing that they're looking at that I think is music to a lot of people's ears is a standard format for provider directories for Medicaid Plan Finder.
Oh, that's a big one.
It's forward thinking. So I don't know if the new administration will pick it up, but I have to say, I would love to see something very standard to cut down on a lot of the noise that we talked about with secret shoppers and things like that, to make sure that data is more accurate. And, you know, there's so much in the final rule, and I don't think we're going to have time to go through everything. So I truly encourage you to go out and look at it. The fact sheet is out on cms.gov. It's still listed in the Federal Register if you'd prefer to go there. But there are some, the CMS site has a great summary. I know, Elvan, you used your friend AI to help come up with some talking points, so you could probably do that.
We've got to give it a name. We've got to give it a name at some point. Not now, but
our imaginary friend, our imaginary fourth host, AI.
Gustavo. Gustavo.
AI.
Gustavo. I don't know, but there is a lot in this rule. Now that, we're 30 days since it dropped on the 4th of April, as I had mentioned earlier. I really, really encourage folks to make sure that they're taking the time to look at it and start working with your teams, however that is. Do those recurring check-ins that Jess mentioned as you're thinking about project managing it. As Elvan said, make sure that you're tapping into your network. Hey, Jess,
Mhm.
what are you doing? Elvan, how are you handling this? Hey, my business owners have no idea how to make this cost sharing zero. What did you guys do? Without, you're not necessarily sharing trade secrets, but it's really a strategy in how to tackle
Mhm.
a big, big,
Mhm.
scary
Mhm.
issue.
Mhm.
And I think you can do that strategically and with knowledge and confidence.
And on a
So,
last note, before we close out, because we could go for another
yes,
hour or so, there's
yes,
just so much. But I'd say it's okay to feel a bit overwhelmed. It's
Mhm.
okay,
absolutely.
right? There's a lot going on, but take a step back and start putting in a basic plan. A
Mhm.
Yeah,
plan will help you keep your sanity and will make you a
Mhm.
lot more effective.
Mhm.
Right? So
Mhm.
deep breath. We're all in the same boat. You're not by yourself. There are a lot of tools and resources, a lot of folks. We help each other. That's what community
Mhm.
is about.
yeah.
So, with that said, if there's any aspect of this rule that listeners would like to explore in more depth or would like us to explore in a bit more depth, please let us know. We've done the work. We're more than happy to have a bigger conversation if you'd like to hear a little bit more. All right. Thank you for listening, everyone. Ladies, thank you for
Thank
all
you.
your insight. As usual, you're absolutely amazing. And I love you dearly. And I will see you next time.
Next time.
See you
Bye
later.
bye.
Bye.
Bye.